This is Dr. Christopher Wood at Arizona Sports Chiropractic, and so far we've showed you some ways of increasing your thoracic rotation, your hip rotation for golf, and also a little bit on showing you some stability. Well, now we're going to start linking them together, so we're going to show you how to link stability along with rotation. I have Jeremy, my assistant here, helping me today, and this exercise is called a tripod. So what you want to do is get on a high kneeling position like this. Jeremy's going to come down, place both hands on the ground. Now, before you do that, if you notice, his back is nice and straight, and this is the way we want it to be. But if he doesn't have the hip mobility to do this, and he's a little bit on the edge, what you're going to do is use some sort of pad or anything that you can put yourself up on. It can be even higher than this, but what we want is a nice straight spine here. Okay? Now, once we're in this position, we're going to work on stability. So we're going to always check our stability points. His foot is concentrated and his pressure is on these 3 points in the foot. His hands, the 2 points in the hand for stability. So he's basically pushing away from the earth with both his foot and his hand, and especially the foot, keeping the stability here. So we're going to start this out with a little rocking. So what he's going to do is he's going to rock back and forth and really concentrate on the connection between his foot and the ground. And he's essentially pushing away from the ground. During this time, he's keeping his kneecap lined up with his second toe, very important, and he's keeping his core tight the whole time. Now, if we were to stop him right in the middle and we were to push back here, you could see he's very stable, and that means that his core is hooked up with his knee and his foot, and we need that stability here as we start our rotation in golf. So now the second part of the exercise, after you get that foot centrated and you get that connection there, now what he's going to do is with the arm on the upside leg, he's now going to go into a thoracic rotation. And he's going to rotate around as far as he can and come back. And the important thing is he's going to try to keep the knee lined up there, and he's going to keep this pelvis stationary. You don't want to rotate your pelvis. Just like in golf, you're going to try to keep this as stable as possible. Core's tight, and he's getting the rotation in there. Now, for some reason, if he's using more of his shoulder and not as much as this thoracic spine, he can put his hand across his chest, and then he can rotate like there, and that'll isolate this thoracic spine, and he won't be using and cheating and using his shoulder quite as much. Okay? So this is called our tripod exercise for getting good stability in the leg with some rocking and with some rotation. And again, if you have any question on these, feel free to call the office. And as a Arizona Golf Association member, you get a discount when you come in as a new patient. So feel free to give our office a call, 258-9663. Have a great day.